All right. Next up, we have Esther Lucero, Executive Director of the Seattle Indian Health Board.
Hey everybody, how are you?
All right.
My name is Esther Lucero, and I'm Diné on my mom's side, Latina on my dad's side, and I'm third generation of my family to live in an urban area. I'm honored to be invited today to speak to you, to give you just a little bit of a different perspective, a Native perspective on what universal healthcare can mean for us. So I have the privilege of serving as the president and CEO for the Seattle Indian Health Board. And what that means is I get to operate an urban Indian health organization that's part of the Indian Health Service system. We are also deemed a federally qualified health center. And what that means is that we serve all people regardless of their ability to pay. It also means that we serve all people in a Native way. We happen to operate a 340B pharmacy to give access to low-cost meds. Those are things that we do. So let's talk about what it means to be part of the Indian Health Service. So let's be real. You know, it wasn't until 1955 that the Indian Health Service was even established. Before that, all Indian issues were, guess what, in the Department of War. How many people knew that?
Oh my God.
Yeah. So when they decided that the Indian problem was now about health and not about war, they established the Indian Health Service system without much funding at all. We've been continuously fighting for that funding. When the Affordable Care Act was implemented in 2010, all of a sudden, it was this great idea to, supplement the grossly funded Indian Health Service system with Medicaid. And guess who took responsibility for that? States, right? So states then gained more authority, and we know when you have authority it means responsibility for health services within Indian country. Right? So all of a sudden, tribes and urban programs, we were used to dealing with the federal government. Because guess what? I'm looking at this sign that says healthcare, not welfare, or not warfare, right? Not warfare. I'm also thinking about the ways that people think about us as Indian people, is that we get special access to some form of welfare. And we do not. We ceded 90% of our land, and we were promised benefits. Healthcare was one of them. So they are prepaid benefits that we've never received fully. Just take a wild guess. How much do we spend on Medicaid? About $10,000 per capita. Medicaid, general Medicaid population. How much do we spend on prisoners? Tell me.
40, 50?
About $5,000 per capita, right? Guess how much we spend for Indians? 3,000. Yes. Do you see what I'm talking about? So our movement towards universal health care paid for at the state level, right, using federal funds, is a smart move. Because the states are already being tasked with supplementing that budget, right? And for us, it's at least one step toward equality.
Yes.
And let's be real, it's not equity. Because equity would be, wow, you gave us 90% of your land, you should have the best health care there possibly is. This should be culturally centered, right? It should be responsive. We should have Indian people first at the table.
Yes.
Yeah, we're not there yet. I am with you if this takes us to the next step of equality. I am with you. Don't forget Native people, okay? We are here. We are with you. We are powerful. We are strong. We know what it means to do a lot with a little, right?
Yeah.
And our people deserve the absolute best. And I'm going to tell you right now, as a Native woman leading a healthcare organization, I will not stop until we get it. And you should know that.
Thank you so much, Esther.